As for the clinical component, I'd like to highlight here also the possibilities and skills of a doctor. The fact is that they aren't limited only to the technical preparation of the tooth, the creation of a latch or taking casts and so on, although this is a very large component and it can be called a craft right when you can technically make a latch, carefully take the impression, etc. But your skills are also very important from the point of view of diagnostics. The fact is that diagnostics is the basis according to which you will plan your treatment. Determining the height of the bite is important, it is. You must give this vertical occlusion dimension to your technician so that he, according to this height, makes this or that crown height. The second one, the position of the occlusal plane. It is located differently in different patients. It's all individual. Don't think that when you grind the teeth, take a very good impression, the technician will do everything for you. In fact, isn't it so? You take impressions, you dissect the teeth, you make some kind of register, and at best, what else do you say? You say the color of teeth, bleach, white. And then, who works? Technician. He builds all the prosthetics, makes a decision about the occlusal scheme, he decides about the type of guidance, canine, group function, or some other, right? That is, almost all the prosthetics is built by a dental technician. It shouldn't be like that. The technician doesn't see the patient, he doesn't perform the diagnostics, he cannot decide whether the patient will have a canine guidance on the one side and a group on the other, and for which reason. There are a lot of questions and a lot of data and parameters you must give to this technician. You must be able to work with the face bow. You must not only be able to work with it, but understand why this is necessary. Set articulator sittings, plan the treatment. If the patient has a horizontal overlap, you must need to anterize, move the jaw forward. Then the construction of the entire occlusion will be in a completely different place. And the fact is that, once again, if you made a mistake in registering the bite, then the technician must to do overall his work again. This is a very big and crucial moment. What is also very important is psychological status. The fact is that if you undertake the total work, grinding all the teeth, you need to understand the following, that this work will last a fairly long time. If there wasn't a depulpation, if the teeth are vital, then our intervention will be accompanied by pain, soreness. That is, we'll need to do anesthesia to the patient, and the patient must somehow bear it. The third moment, casts, fixations, temporary prosthetics, all this, of course, is also difficult for patients. Therefore, from the point of view of psychology, you must be able to support them. I call it supervision of the patient. A very simple example, you can perfectly do technician work, prep the teeth, take casts, everything is fine, we give standing ovation. The technician made a beautiful crown or the greatest prosthesis. But answer me the one question, if the patient is depressed, will he accept his work? He has a completely different look on it, because our actions are completely unpleasant to the patient. All our interventions, they are very painful, because the patient doesn't come to us unexpectedly, and the following must be understood. If the patient undergoes a total rehabilitation, then we do not do this with a healthy patient. Where are this patient from? From the risk group. Therefore, your opinion, your firmness, your ability to support in time, do something, raise the awareness of the patient, talk with his relatives, ultimately will be one of the components of your success. Technical skills, I talked about them. It's definitely that you should be able to prepare not only the front teeth, where it's very convenient access, good visibility, and so on. And it doesn't require again a wide opening of the mouth. Yes, you must be able to prep the 8th tooth and the 7th tooth and the distal surface and the buccal and whatever. You must be able to form a latch, take a good impression, but it comes with an experience of through training. Why is it important to know the related specialties? This is the first point. Diagnostics, planning, psychological status, technical skills, knowledge of related specialties. The fact is that knowledge of related specialties allows us to avoid so many mistakes even before our intervention. During the planning process, you can clearly realize it if you understand this specialty, which requires, for example, the intervention of an orthodontist. Or when planning an implantation, you understand that where and how it will be carried out, what type of implant it would be, whether the implant will be installed subcortically, have you soft tissues enough, is there a need in additional surgery to augment the bone graft or the soft tissues. You should understand all this as a dental prosthodontist. Otherwise, during the process, for example, after temporary prosthetics, you may be surprised to note that you have a big, long, ugly teeth, ugly cervical zone, and the patient sees it. And here at this stage, you need to explain again to the patient that additional money is required to pay for work with soft tissues, for the surgeon work, additional operations that are quite painful, with an extraction of the mucous graft from the palate, etc. Prolongation the time of work, all this appears suddenly in unexpected ways, completely at unexpected moments. To avoid this, once again, you need to understand related specialties, such as orthodontics. Over the past few years, I participate mainly in orthodontic courses, although I'm a purely prosthodontist. Your understanding of implantation, surgeon per se, all this contributes to more detailed planning and, accordingly, the achievement of a good result, because there should not be any news for patients within the framework of total prosthetics. Yes, something went wrong again. This should not be. But again, when making a decision, largely you rely on your experience. You can take a lot of courses, you can listen to our videos, they will help you very much. However, the most correct questions, the most correct decisions are made on the basis of your own experience. As the proverb says, the best is to learn from the mistakes of others, and it helps us, but the main training is still on our own mistakes. And here is my task to try to warn you, to give the tool that will allow you to avoid these mistakes, or at least see the pitfalls we have. Well, a mortgage. You know, I've come across the fact that doctors are exposed to rather desperate actions by having debts or some other moments. I would very much like that such elements do not serve as a guide for you in deciding on total prosthetics if the patient comes for occasional hygiene or for treating cervical caries. The fact is that good patients will come, and everything will be fine, that you will get your money. Once again, the decision on total prosthetics should not be imposed, for example, by the marketing part of the clinic administration. Just how it has to be and no other way. We must act from clear, perfectly clear and unambiguous statements. Second moment, once again, the decision about the total prosthetics should not be made just out of the blue. It's a comprehensive solution based on a number of diagnostic measures, planning, connection your related specialists who work in your clinic, involving other specialists who can help you and consult. Carrying out again more detailed planning in digital format when we conduct a simulation of treatment, for example, in programs such as OnyxCEF. All this allows us to mark up this work once again, carrying out wax modeling, mock-up, wax-up. All this work serves for making more detail and clarify our diagnosis and our planning even before we grind some teeth. Therefore, precisely the interdisciplinary approach, precisely the integrated work, understanding of the technical stages, understanding of related stages will allow you to achieve a very good result in your work. All that I said above was formed and generalized by me on the basis of a fairly large experience in conducting total rehabilitation in a separate protocol, and by it I will tell you in more detail in our next video, which will be in the end of the case associated with prosthetics of 2 front teeth. How did we act? I'll tell you in more detail, and for now, bye!